Founded in 1991, the Society of Infectious Diseases Pharmacists is an association of pharmacists and allied health professionals dedicated to promoting the appropriate use of antimicrobial agents. The mission of SIDP is to advance infectious diseases pharmacy, lead antimicrobial stewardship, and optimize the care of patients with infections. We're the professional home for a lot of different roles that ID pharmacists play. For people who are in academics and teach future pharmacists, for people who are at the bedsides, we are stewards, we are researchers. There's no other concentrated home for everything related to ID pharmacy.
The resources that SIDP provides is a lot of networking opportunities.
And opportunities to innovate or to develop new ideas.
If I can say one thing that's been really the most valuable experience of being an SIDP member for me, it's been the relationships I've built with other pharmacists.
It's a good networking opportunity to bring together different infectious disease pharmacists.
Over the years, I got my first research grant from the Society.
It provides a wide range of educational programs, board certification, preparatory coursework, and even podcasts by experts in their field around the country.
I help community hospitals.
A lot of my role is dealing with patient care.
Most of my time is spent working with the lab here.
I've helped develop new drugs and been very involved in getting these new drugs to patients while they're still under investigation.
I work on our antimicrobial stewardship team where we provide high-level oversight to how antibiotics are used throughout our whole hospital.
I am an antimicrobial stewardship pharmacist. So antibiotic stewardship, in the most simplest description, is optimizing the way we use antibiotics. Because we know that every time we use antibiotics today, it is not a given that we will be able to use that antibiotic in the future.
Stewardship not only takes care of the patient at the bedside and makes sure that that individual patient is on the right drug, but also looks at, are we using antibiotics responsibly across the larger healthcare system?
Pharmacists today are leading many types of research in antibiotic stewardship.
Whether they be clinical and hospital-based, things about patient care, or even the tools that we use to identify certain infections.
I do a lot of research on antibiotic allergies.
Our lab spends a lot of time really just figuring out how much of an antibiotic is somewhere. If you have an infection that goes into the brain, how much of that antibiotic goes into the brain?
The things that we're doing craft guidelines. So when you hear that there is a drug of choice to treat an infection, that's because there was research done, often either led or co-led by pharmacists. We're very involved in advocacy for our patients and making sure individual patients get the therapies that they need, but also advocating to make sure that new drugs are developed for the public.
We have made it an important mission to come up with education to the public, what they should be thinking about for COVID-19, how they should be approaching vaccinations and things like that.
One of the big things SIDP does is continue to fight for a seat at the table for infectious diseases pharmacists. The organization has really grown exponentially in the last 30 years. We've partnered with other organizations recently, including the Infectious Diseases Society of America and the Society of Healthcare Epidemiology of America.
They're very engaged nationally as well as internationally. They're helping to set policy. They're interfacing with groups such as the FDA. We have pharmacists that are involved in research to find tomorrow's cures for the infections that we do not know yet exist.
SIDP's vision is safe antimicrobials for now and the future. It's really important to the general community because part of what the ID pharmacist does is they help minimize overuse of antibiotics. And so we have to make sure we're using the right antibiotics to treat the patients we have today, but we're also preserving them for the patients in the future.